In an order paper question to the federal government, outspoken Conservative MP Leslyn Lewis posed some tough questions regarding Canada's pandemic response and our adherence to the so-called One Health approach, a concept that aims to address what is called the full spectrum of disease control, from prevention to detection, preparedness, response, and management, that contributes to global health security, as per the World Health Organization known as the WHO. Lewis asks, before any new initiatives and policies are implemented in Canada, if the government has formally reviewed the response to COVID-19, and if not, why, and when can Canadians expect such a review? Lewis also asks how the government defines a pandemic, and what exactly does One Health mean, in their view. She furthers that if the government doesn't have a definition, what's their plan to align with global standards the WHO is proposing through amendments to things like the international health regulations and their new pandemic treaty, including how the government is preparing to implement a One Health approach as part of its public health planning, and to what extent do greenhouse gas emission reduction targets play in the government's One Health approach.
We do not need the WHO to limit our healthcare sovereignty. We need to create our own pandemic strategy where our government is accountable to us. Canada is a sovereign nation. It should maintain control of its healthcare system, including its pandemic response and planning. We need to increase the capacity of hospitals to deal with the pandemic. We need to make sure that we have pandemic funding that will relieve some of the burden that was put on the healthcare system. When we look at lockdowns are an indication of a broken healthcare system. We need to make sure that we create beds, that we can better respond to pandemics, and we do not need an international organization like the WHO to tell us how to do that.
The Public Health Agency of Canada, overseen by Chief Health Necromancer Theresa Tam, responds that there have been a number of reviews and reports discussing Canada's COVID-19 response, especially the Public Health Agency of Canada's COVID-19 response lessons learned document, which isn't actually publicly available, and the complete report is only available upon request. The agency repeats some talking points that protecting the health and safety of Canadians remains a top priority for the Government of Canada by revitalizing the continually disregarded Canadian Pandemic Influenza Preparedness Planning Guidance for the health sector, which clearly outlines that good decision-making is essential for ethical decision-making. This includes openness and transparency, accountability, inclusiveness, and reasonableness. All things that were ignored when knee-jerk and hysterical lockdowns were implemented countrywide, and provinces and territories were incentivized financially to implement vaccine mandates through the COVID-19 Proof of Vaccination Fund. COVID-19 responses were arbitrary, irrational, disproportionate, and non-evidence-based, disregarding all previously well-established pandemic response plans and ignoring the 4 pillars of outbreak response, which rely on effective leadership, properly validated testing and data, not faulty PCR tests for asymptomatic people run at high cycle thresholds, treatment and prevention, not waiting until people cannot breathe to treat them, resulting in secondary infections from ventilators that ultimately caused their death, and finally, communication. No back and forth, wishy-washy advice like, don't wear a mask, closing the borders is racist, just kidding, we're going to close the borders, being vehemently opposed to vaccine passports and then implementing vaccine passports. The list, quite literally, can go on and on. In PHAC's response, they confirm that they don't have a definition of a pandemic, but are rather relying on the controversial private interest group, that's the WHO, and its not yet passed international health regulations to define a pandemic emergency. Pandemic emergency is tentatively defined as a communicable disease that has or is at high risk of having wide geographical spread to and within multiple states, exceeds or is at high risk of exceeding the capacity of health systems to respond to those states, causes or is at high risk of causing substantial social and or economic disruption, including disruption to international traffic and trade, and lastly, requires rapid, equitable, and enhanced coordinated international action with whole of government and whole of society approaches. According to the WHO, the IHR definition of pandemic emergency allows for the triggering of more effective international collaboration in response to events that are at risk of becoming or have become a pandemic. This definition is disturbingly vague and open to interpretation with the use of words like may or could have, might exceed, could cause, etc. The use of terms like high risk, substantial, and may aren't reliable and leave a lot of room for uncertainty and subjective judgment, with no clear definition of the conditions required or criteria necessary to make such a sweeping declaration of a pandemic. The agency responds with One Health talking point stating that the approach emphasizes coordination across human, animal, and environmental health sectors to address complex health threats like antimicrobial resistance, zoonotic diseases, and climate change, with federal departments collaborating through an interdepartmental deputy minister committee on One Health to advance priorities in areas such as surveillance, research, and policy. This may sound great, except that an interdepartmental deputy minister committee on One Health isn't listed on the publicly available committees list. The response furthers that the One Health approach grounds how the federal health portfolio works horizontally and collaboratively with other federal departments and across disciplines on a range of infectious diseases, but really sounds like nothing more than a well-crafted, verbose series of buzzwords and vague assurances. While the Public Health Agency of Canada outlines a supposedly collaborative framework between animal, human, and environmental health, it seems to lack any sort of real or actionable details. The emphasis on coordination and communication reads more like a public relations effort than a concrete plan to address any sort of pressing, interconnected health threats that they claim we inevitably face, like disease X, an imagined, unknown infectious disease that could emerge and may pose a global health threat. Hyper-focusing on an imagined threat like disease X is textbook scaremongering and paves the way for the misallocation of resources, unnecessary fear, and neglect of current health needs. It screams scientific and political opportunism, easily exploited for financial gain by industry and government to secure funding and justify broad policies based on speculation. Despite the lofty claims about surveillance, diagnostics, and engagement, the response provides little insight into how these initiatives have been or will be actually implemented, or how they've improved pandemic preparedness in the 4 years since COVID hysteria stole rational thought and evidence-based decision-making. The response references international frameworks and high-level panels, but fails to clarify how Canada's domestic policies will safeguard our health sovereignty and prioritize the needs of Canadians as global health agendas, driven by private interest groups and the pharmaceutical industry, continue to evolve. What's glaringly absent is any clear accountability or transparency in how these strategies are executed. There's a lot of talk about collaboration and innovation, and even a hit about countering misinformation, but no substantial evidence of tangible results or improvements in public health infrastructure. It's a classic case of bureaucratic language designed to deflect criticism without committing to anything substantial. Ultimately, it all boils down to this. Who exactly is pulling the strings in Canada, particularly within Health Canada and its subsidiary, the Public Health Agency of Canada? Are these institutions truly serving the interests of Canadians and upholding the principles of democracy, where elected officials are supposed to be accountable to the people, ensuring a balance of power between the executive, legislative, and judicial branches? Or are they merely rubber stamping directives from private organizations funded by corporate pharmaceutical interests to carry out the will of globalist elites whose priorities are far removed from the needs of everyday Canadians? For Rebel News, I'm Tamara Ugolini. If you agree that Canadians deserve a government that will serve the people instead of its own interests or the interests of private organizations, then send a message to the Leader of the Opposition, Pierre Poilievre, urging him to take bold steps toward reforming Canada's bureaucratic system at /thebureaucracy.com. That's /thebureaucracy.com.